Yeah, can you hear me?
I can indeed. Thanks for talking. How are you?
Good.
Staying busy.
Busy.
Yes, indeed. I appreciate it. So, I mainly wanted to talk about the state's testing and how that has changed or is influenced by the way that the state is sort of opening up.
I mean, the overall strategy has always been to get a handle on how much COVID-19 disease is present in the state, looking at the number of new cases on a daily basis, looking at the cumulative number of cases, trying to establish where we are on the curve, so to speak. Testing is yet one metric that we use. Obviously, it's part of a grander strategy. It's really important in the strategy we call containment. Let's say in Vermont, or actually in the entire United States, when the COVID epidemic began, we actually had testing capacity as a country. We could have practiced a containment strategy, meaning test all the people that were out there who were symptomatic, isolate those who had the disease very quickly, contact trace around those people, and then quarantine those who were very close contacts. And now going forward, because we've reached a point where we actually have succeeded in reducing, flattening that curve, and in reducing the quantity of new cases on a daily basis. Now going forward, it's going to be important as we enter a period of suppression of the virus to really try to do containment anytime outbreaks erupt, whether it be in a community, whether it be in a long-term care facility, or what have you.
To that point, how does the reopening of the economy change that testing approach?
I don't think it changed it at all, because it's like a chicken and egg thing. One begets the other. So you couldn't get to the reopening of Vermont unless all the strategies to date had worked. And now that they've worked, and there is a period where we hope we can view it as very low-level activity or suppression of the virus, containment is an ideal strategy to really move forward with, which means testing whenever you have the opportunity to help in terms of disrupting an outbreak by finding it quickly, ascertaining it's COVID, and going through that cycle again of test, isolate, contact trace, and quarantine.
My colleague and I learned this week recently that Vermont has a capacity to test 2,100 people a day and is testing about, I think on average, 425 or so since the beginning of April. Help explain to me that discrepancy. Is that part of what you're saying about where we are in the progression of the virus?
See that?
Oh, wow.
So that's called syndromic surveillance. What this graph shows is that for the last month, we've had a diminishment from a high of about 6% of those visits to a low of down to close to 1% of those visits being due to COVID-like illness. If testing is pretty much determined by outbreaks in facilities or by people like you and I who might develop symptoms and call our doctor and say, gee, I think I might have something, and the doctor would say, let's test you, you can see that we've reached a point in time where there aren't that many complaints. If I could be so bold, I would certainly say that a lot of what's happened with stay home, stay safe, social distancing, masking, all of that have reduced the level of COVID illness in the population. That explains why lately we've had less tests per day, because there's less going on out there.
There are people experts and biologists and that kind of thing who say, especially as you start to open up the economy, there needs to be just a much more widespread approach beyond testing people who are just symptomatic. And the three areas I've heard recommended are random testing of people who are asymptomatic, testing everyone who's about to go back to work, and then aggressive testing of everybody through contact tracing of everybody who's come in contact with a person who's infected?
Yeah, well, the biggest question in testing is, do you just test a whole bunch of people who have no symptoms or not? And then what do you do with that information? That's a huge challenge for any state, because you can't just test a little here, test a little there. You need to sort of have a strategy that samples enough of the population that you're getting an accurate look at that. Most places haven't been able to get even close to that because they could barely test the people who had symptoms, never mind the people who are out there without symptoms. So I think that's a real challenge. And that's the thing we've debated forever, because they have to then decide, what are you going to do with the information?
And you just haven't found a way to use that? Because it seems like Vermont has the tests and the capacity to be able to do that, and a small population to potentially get a significant sample size.
I think so. But, then you have to have issues of equity, like, well, did you test one community and not another community? Or did you test a certain number of people in each community? Or, you have to really think it through very clearly in a population, again, that might not want to be tested. If you have no symptoms, why would you want to be tested? You may just want to know if you've got the virus or not. But at the same time, in a state like ours, where the curve I've shared with you gets as low as it gets, I'm not sure it helps at that point. It probably helped way back on the left side of the graph more than it would help now.
I see. Okay. Well, thank you very much, Commissioner. I really appreciate you taking the time. I know you are very busy, so.
No problem.
Thanks again. Have a good one.
Bye.